Hello, my name is Dr. David Flamenco, and today we're going to be showing what to do after a frenectomy, also called frenotomy or frenulectomy, which is basically removing tissue that's tying up the upper lip so it decreases the mobility during breastfeeding. The same happens with the tongue. There's also an attachment underneath the tongue that does exactly the same thing. Now, some of you may be frustrated or trying to figure out, why is my baby not latching on properly during breastfeeding? That's usually due to that tongue tie or lip tie issue. Definitely consult with your physician, lactation consultant, or a dentist to see if they can help you any further with alleviating those types of frustrations during breastfeeding. So during these procedures, the main reason why we would do this is actually to prevent a gap on the upper two front teeth. Mainly the breastfeeding would be the main issue for doing this. It's minimally invasive, and there are other situations to where we can also have difficulty eating, gum recession, speech impediments, and later on in the future, if this procedure isn't done, this may also lead to other issues such as headaches, abnormal maxillofacial development, crooked, gapped, and basically malocclusion teeth, and also abnormal jaw development, among other issues. So please consult with your dentist, for further evaluation and other issues that may arise. So we are going to be going over a video that we recorded for you guys, just to kind of go over, the procedures on what you want to do after, or basically post-care, after you have your frenectomy performed on your infant. And the most important thing here is you'll see in these photos that you can see the attachment, that it's going from the palatal portion attaching onto the gum and to the vestibule or the upper lip, and it's making that really short so the lip is unable to flange. And in the next photo, you can see we're just putting a little bit of pressure on the lip, it starts to blanch or turn white, meaning there's not enough space for that lip to raise. So this can also be an issue, like I said, later on during speech, which can be very hard on a child growing up, having to learn how to speak and then having the frenum detached later on, and possibly hiring a speech pathologist to correct their speech later on. So if you look at this next photo, we actually show, underneath the tongue, you can see there's a slight attachment issue, not too major. But in this case, since we are seeing it, we're going to address it now, just to prevent any issues in the future. And where you see that connective tissue, or that little fibrous tissue that's on the upper lip and underneath the tongue, that's where you want to take care following the next day. You want to actually swipe your finger gently, use a nitrile glove to prevent any type of allergic reaction with rubber or latex. And you're going to place your finger slightly under the tongue, back and forth gently. It could be 1 to 3 times. And then you're going to follow and massage basically that upper lip area. Follow your finger underneath the lip and just right around there by the nose, going from left to right or right to left, and just gently press on that. So you're going to do this 6 to 8 times a day for the next 6 weeks. That's very important. When the child is breastfeeding, you also want to make sure that their lip is flanging, or you can also do exercises with the child, after the 6 to 8 times. That also helps. It's very important to just stretch out that lip so there's no reattachment. So if you don't follow these directions, the risk of reattachment is pretty high. You can also have that attachment basically going back together while it's healing, and then we would have to have a second surgery. Sometimes the first surgery isn't enough, and we might actually have to do a second surgery. It really just depends. It's case by case, patient by patient. So definitely consult with, the expert that is going to be performing the frenectomy for you. So without further ado, please feel free to watch the video, and it just shows you, how you can care for your child after the procedure has been completed. Thank you for watching. Say bye-bye. Hello, my name is Dr. David Flamenco from Helix Dental, located in La Mesa, California. And today we're going to go over protocols after frenectomy, what you need to know, what you need to do, whether it's an infant, even a toddler. In this case, we have our son over here who had a frenectomy done on his upper lip and lower lip. So there was a lower tongue tie on the posterior section and on the upper tie of the lip. And the most important thing is 6 times to 8 times a day, you're going to be relieving the pressure so there's no reattachment, and you'll have less risk of having a second surgery that might need to be done. And you're gonna be doing that for 2 weeks. So once again, you're gonna be placing your finger with a nitrile glove right on the upper lip where the attachment was freed. And you're gonna be putting gentle pressure there. And you'll do the same thing for the tongue. And you're gonna be doing that, like I said, 6 to 8 times a day for 6 weeks. So definitely talk to your pediatrician if the procedure needed to be done. You can also talk to a lactation consultant, and a dentist can help you with the frenectomy. So that's very important. So right now I'm gonna show you what I mean. So we're gonna have him placed over here right before we're gonna do that procedure. You wanna make sure it's right before feeding. And this is to help with the latching during breastfeeding. So in this case, I'm gonna place my finger right here, right under the tongue, and just swipe across. Same thing on the upper lip, right across, and we'll have that bottle ready. And there we go. So you can see that the attachment's freed up, that the upper lip is able to move and grab. So that's the most important part, because this can actually prevent the baby from having enough nutrition. So you wanna have a healthy baby, make sure that he's growing correctly with all the nutrition that he can get from the mom. So this helps with breastfeeding. And like I said, this is to prevent a second surgery due to reattachment. So that's very important. So if you have any questions, feel free to call us and let us know. Thank you for watching. And once again, he's only 3 days old. The procedure was done yesterday. So he was 2 days when he actually had his frenectomy performed. And you can see it's pretty harmless. But the most important thing is that you continue freeing up that tissue so there's no reattachment. Thank you again.